Synchronized Cardioversion. Synchronized Cardioversion is used to restore a normal heart rhythm in a patient that is hemodynamically compromised due to a tachydysrhythmia. And it's usually severe hemodynamic compromise. Rhythms that we're going to see with this are pulsatile VT with significant hypotension, SVT with inadequate perfusion, and also probably other symptomatic conscious tachyarrhythmias. Looking at the procedure of how we go about it, we are obviously going to complete our normal scene risks assessment and safety plan for the patient and staff. Going to get that lovely 360-degree access like we normally do, and have the patient in a position that we can manage them easily. Be prepared to support the patient's ABCs, make sure that they've got a patent airway, that you have your airway equipment nearby, and that you have oxygen nearby as well. Provide some supplemental oxygen like we've got here, also with some end-tidal CO2, and also again preferably bilateral large bore intravenous access, and get some fluids running with that. Obviously, you need to keep an eye on the patient's vital signs, blood pressure, ECG, SATs, end-tidal CO2, and respiratory rate. Prior to commencing the cardioversion, we want to obtain a 12-lead ECG and have that interpreted thoroughly, and maybe even have it checked by another clinician as well. And then we need to address any reversible causes that may be contributing to the patient's dysrhythmia that is possible to be addressed in the pre-hospital setting. If we continue to be symptomatic of the tachydysrhythmia, then we're going to have to move to synchronized cardioversion. Prior to doing that, we're going to need to explain what we're going to do to the patient, and procedural sedation may be required in order to undertake the procedure safely and without causing much pain or distress to the patient. Obviously, with procedural sedation, you're going to prepare that airway equipment and have your suction and ventilatory support nearby. So we're going to place the ECG electrodes not near where we're going to need to put the defibrillator pads. Defibrillator pads will need to be placed preferably anteriorly, posteriorly, but can also be placed in an anterolateral position. If they have an ICD in situ, then you should probably make sure, like I've done in the past, have the pad not near the defibrillator. The defibrillator should then be turned on. Obviously, we'd have this in monitor mode, have the 12 lead done first. This is going to pop up and say that we're in a normal sinus rhythm, but let's say that we are in an SVT at a rate of 200 with a blood pressure of 60. The next thing we're going to do is dial this up to the first dosage of joules, which will be 50. And the next thing we're going to need to do is synchronize the monitor to the ECG. By pushing the sync button, we should then get a flashing sync light and then markers with each R wave of the QRS complex to indicate that the machine has appropriately identified the QRS complex. We're going to charge, and then we're going to make sure that everyone is clear and safe and deliver a shock. We're then going to reassess the ECG and the patient's presentation. Hopefully the ECG will have returned to a sinus rhythm, or a rhythm that is more hemodynamically stable. We're going to reassess their observations and their conscious state to see if it's improved. In the situation where it has not improved, we can then further reattempt the cardioversion another 2 times, and each time we can double the dose as per most research suggests, or as per whatever your local clinical practice guidelines suggest. There are some contraindications for synchronized cardioversion. Obviously, a patient who has a tachydysrhythmia doesn't automatically qualify for it if they're adequately infused. And if they're in a ventricular fibrillation or in a pulseless VT, well, then that's a cardiac arrest, and you need to manage that as such. Complications include, obviously, shocking through the chest is pretty painful and uncomfortable for patients, so you need to manage that. You can potentially also shock into a cardiac arrest, which is not ideal. So for considerations, you always need to consider any other potential cause for the tachydysrhythmia and address that if you can before commencing this procedure. If the cardioversion is unsuccessful, perhaps consider changing your pads or confirm that your pad placement is good. Maybe even consider that your monitor is the problem as well, and make sure that it is synchronizing appropriately. Obviously, you need to be familiar with the device that you're using, and some devices have built-in automatic a dual selection for cardioversion, so just be sure what the dosage is that you're giving. And that is Synchronized Cardioversion.